Welcome to our October 10th, 2024 Public Safety Funding Committee. I call the meeting to order. We'll ask our Executive Director, Danny, to conduct the roll call.
Chairman Lewis.
Here.
Councilman Robinson. Chief Butler.
I'm also here.
Chief Tobin.
Here.
Jason Baran. Marissa Calderon.
Here.
Dr. Noggle.
Here.
And Barbara Roderick.
Here.
All right, we do have a quorum, Mr. Chair.
Thank you. Minutes from our last meeting need a motion and approval.
Mr. Chair?
I'll entertain a motion.
I'll make that motion to approve the meeting minutes from September 12th, 2024 as presented.
Thank you. Is there a second?
I'll second.
With that motion and second, all in favor say aye.
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 Aye. Any
Aye.
opposed? Thank you. Agenda item number 4, opportunity for public comment. I understand we have not received any comments for today's meeting. Is that correct?
That is correct.
Okay. Agenda item number 5, update on outreach webinars. Kristen Dar of Central Creative, Kristen will ask you to come forward and get us prepared for some future meetings. Thank you, Kristen.
Thank you, Mr. Chairman and members of the committee. It's a great honor to be here. I have been a resident of Maricopa County since 1995, a property owner since 2001, and also a small business owner since 2001. So I've really enjoyed learning about this committee. It's been really an honor to assist. I am the principal and owner of Central Creative, and we are focused specifically and solely on the stakeholder and public engagement needs of public infrastructure projects. I'm here today to talk to you about the public outreach plan for some meetings coming up. So I will advance to the next slide here. So as you can see on the slide here, the purpose of the public outreach is to provide an opportunity for residents of the county to understand what the committee has been doing since it was created earlier this year, understand more about the detention fund, the jail excise tax, and the draft recommendations that you are forming now. We are also intend to gather public comments to help inform your recommendations. At this time, we have 2 virtual public meetings planned. The first is Thursday, October 24th at noon. The second is Monday, October 28th at 6 in the evening. They will be on the Zoom platform, and the format will be a presentation provided by staff and a facilitated question and answer session, and I'll be the facilitator of that. Members of the public who attend the meeting will be asked to write their questions and comments into the Q&A dialog box at the bottom of the screen on Zoom. And after the presentation is complete, we will read the questions aloud and the appropriate person will answer those. So I know you, Mr. Chairman, and a number of the Vice Chairman, Jason Moran, and several members of the county staff will be panelists for that presentation, for those presentations. So to prepare for this, these 2 public meetings, we have prepared a publicity toolkit intended for deployment from today through the 28th of October, which is the second meeting. And you have this, I believe, in your packet. And has the committee received the toolkit yet?
Yes, I did send it out by email just a few minutes ago.
Okay, so you just received it, everybody, by email right before this meeting. The toolkit includes images in English and Spanish for Facebook and Instagram, along with accompanying text that can be part of the post. So it also includes images for Twitter. It includes a flyer for email distribution, provided in a variety of file formats, and text for e-newsletters. The toolkit is being provided to members of the committee and also to the Board of Supervisors offices, and also is being provided to Maricopa County Communications, who intend to do social media posts in both English and Spanish. They are also going to be able to provide some of this information in some email distributions that happen on a weekly basis, Board of Supervisor newsletters, and then we also invite the committee members to deploy this information, post the image with the associated text, email out the flyer, and hopefully encourage participation in these meetings.
So we're part of the marketing team.
You
enlisted us.
are. Yes, yes. I have found over my 30-year career that it is very helpful to have those closest to the decision and leadership at the agency that's sponsoring the effort to post on their channels and to get the information to help us get the word out. So in terms of public comments, the meetings will be recorded. The panelists are going to be able to answer questions about the committee and the committee's efforts. We'll take comments on anything. Again, people will be able to type their comments into the Q&A dialog box on the Zoom platform. And also, if there are questions about efforts outside of this, the staff will work to answer those questions and provide a written document that answers all of the questions subsequent to the meetings, and then be able to post that on the committee's website. And then I am scheduled to come back to you on November 7th and provide a report of what we heard. Did I miss anything? Okay. And then I'd be happy to answer any questions that anybody has in the room or online.
Any questions from the committee?
Yes, I have a question. This is Marisa. I have a question on Zoom here, or Teams.
Please.
Was the Spanish? I was quickly reading through the Spanish versions of the outreach. Did that already go through? Folks that check that?
The Spanish was originally provided by my staff Spanish translator, and it was reviewed by the County Communications Office, a public information officer, yesterday.
Okay.
Thank you. Marissa, anything else you wanted to expand on that, or did that answer your question?
So, Mr. Chair, we, with the toolkit that we have, can send out as we speak. I mean, it's ready for us to post or move now, right, after today?
Yes, so we've provided it to you all, and we are working on updating the Public Safety Funding Committee website so that it'll all be available on there after today as well.
Okay.
Yes,
I
feel
have
free to
10
start
friends
sharing.
on Facebook, so I'll send it.
We can't wait to hear from all
We
10 of them.
expect 10
All
people
10.
to
I hope
join
it doesn't
us.
break the system, but I'll do the best I can.
Any other questions or comments? Thank you.
All right, thank you for having me.
We'll see you again.
You will.
And Mr. Chair, I just want to note for the record that Jason Brand has joined us online as well.
Great. Welcome, Jason. We move to agenda item number 6, a presentation on community reentry. Lisa Struble and Janine Fowler, please.
Hello, Mr. Chairman and members of the committee. Thank you for having us back. You've heard from me a few times on this topic, but we wanted to go a little bit farther to address some of the questions that we'd have from previous presentations. And with me today is my colleague here.
Hi, good afternoon. My name is Janine Fowler. I'm the Executive Director for Maricopa County Public Health.
Thank you for both being here.
Of course. Also on our virtual meeting, I have a Community Transitions Manager, Julie Wansowitz-Moore. She is our subject matter expert here, so we'll do our best to get through this, but in the event I can't answer something, then Julie is here with us as well.
I think if you click to the right, it should.
Okay. Great. I like structure, and so for me, I'm always referring back to the sequential intercept model. So I'll just introduce that briefly if you're not familiar with it. It's a model that is nationally accepted, started in the early 90s, and it was developed in response to seeing an increase in individuals with mental health issues, and now, of course, substance abuse issues have been looked into that. Increasingly involved in the criminal justice system. And so it was an attempt to categorize, or it's an accepted method of categorizing the different intercepts along that criminal justice path of where we as the community can be involved to intercept those with mental health and substance use disorders, to prevent them from either continuing farther into the criminal justice system, preventing them from entering it in the first place, or also preventing them from re-entering it after. So that's really the model by which we operate. And in the jail system, of course, we're at Intercept 3. So that's where folks are incarcerated. And if you can't see Julie online, there she is. There is Julie. So within our jail system, we've developed over the course of the last 10 years, in particular, a community transition team. And that team serves multiple functions. It's maybe the easiest concept is if someone is in our system with an acute medical need, that community transition team is linking with services. So once they release from our custody, they've got continuity of care, for example, oxygen, wheelchairs, those kinds of things. But more than that, of course, are linking folks with services to address certain high-risk areas: homelessness, mental health, opioid use disorder, making sure those folks are linked with services once they leave the jail, that they've got continuity of care. Let me see here. So you've all seen our ITR, you've seen intake. There's one of our nurses. This starts for us right at intake, and I've touched on this before, so I won't linger too long, where we've got a list of 41 questions that identify those with high need, both medically, for medical, mental health, dental, but also issues such as homelessness, and helps our community transition team identify those that need the most help on a safe transition back to the community. So just to give you an idea, when we're talking about resources and what we've got here, we've got 8 full-time positions. 6 of them are employed through the detention fund, and 2 of them are contract employees through a grant from Public Health, which Janine is going to speak to you a little bit more in future slides. So it's a small team, but I want to describe to you some of the things that they do. Very important to us is to make sure as many of our patients are access enrolled. So even if their access benefits are suspended while they're in the jail, we want to make sure that if they're eligible for services once they go back into the community, that enrollment and application is processed. They also coordinate with our high medical need patients and reach-in navigators, which I'll describe more in just a minute. They coordinate care with the outside clinics who service those who are seriously mentally ill. So that's right at intake when we do the receiving screening. We've got an automated feed from the state that tells us that someone is SMI. So we know that already electronically on the back end, and we can initiate connecting with those clinics, especially if someone is not active in their care in the community. Sometimes it's very beneficial for those clinics to know where that individual is now. So we've got an opportunity to reconnect them with care and their clinics. We start creating transition plans. The community transition team, when possible, also will coordinate medications upon release. So if we know ahead of time that someone is going to be released, which is tricky in our system, but if we do our best to get those medications to them so they've got a bridge going back out to the community. We also provide them with a list of community resources. So this is in development, and we're in the first stages of that, where we're providing them truly with a piece of paper in conjunction with MCSO. Time of release, we've provided a list of resources. MCSO will make sure it's available to them when they leave. So I want to speak a little bit about the our community navigators. So there's two slides about this that I'd like to talk about. The first one here is our Access Reach-In navigators. So most of the access plans have got justice liaisons assigned to them, whose job it is, the purpose it is to reach in to their patients who are in custody with us. So this is no cost to the county, anything else, but the community transition team helps make these reach-ins possible. So it's all through MCSO inmate video visits. Our team will help schedule those appointments, make sure that the patients are reminded about those appointments to participate. It's, from what my understanding is, that it's innovative from across the country. Because we have so many access plans and health plans here in Maricopa County, this is a great opportunity for those plans to reach in. We really value this service. Even it's not in person, it's virtual, but there's a lot of work that goes on the back end to make those appointments happen. Just as an aside, we've got electronic information sharing agreements with all of those plans so that information for continuity of care can be shared conveniently. So, and on the previous slide, I have warm transfers. That maybe should have been on this slide. So warm transfers, though, are what research has shown us, that if individuals are connected with an individual, someone that they can meet, talk to, preferred if it's someone with shared experience, someone who they're going to then be familiar with and be able to connect with once they're in the community, that their engagement in services once they leave the jail are at a higher success rate when they've got that actual connection with someone. So because of resources, and I think to some of the comments that you've heard from prior meetings, some of this responsibility falls then to the community, right? So once they've left the jail, and the county's responsibility, what is the community's responsibility for connecting and then receiving those individuals? So we've connected with multiple agencies across the valley that we'll talk a little bit more about. There's a listing of them here. As example, some of these navigators will do follow-up appointments for those who are suffering from opioid disorder. It might be mental health appointments. It might be connecting with housing, or we're going to talk a little bit, Janine's going to talk a little bit about a doula program and prenatal support, those types of things. And we also partner with our Human Services Department within the county here, another partner department to us, on those with experiencing homelessness and who have multiple bookings. So research has also shown that after those multiple bookings, those of course are the folks who are the biggest draws on the criminal justice system. We really want to address those individuals who've got that high recidivism rate and get them connected with services the best we can. I want to speak just briefly about the navigators. So I said, ideally, this is someone that you know, someone, who maybe could even come into the jail and speak with you, and then someone that you're going to be able to see in the community. That's challenging in our environment because particularly it's a jail environment and background checks are not always easiest to get through for those who have got lived experience coming in. So we do our best to link virtually now. We're excited to have virtual opportunities for linkage. And then that's where we're looking to Julie's team inside, who can be that, warm connection to then do as few handoffs as we can back out to someone into the community that they're familiar with. I can say that the individuals with those high needs are very successfully linked between these, the reach-in plans and then these specialized navigators that we've been able to have into the system. And I'll pass it over to Janine to elaborate a little bit more on a couple of those.
Thanks. So I'm here today just to talk a little bit but here at Public Health, we're consistently looking for opportunities to link with CHS. We know that the more we can do for someone who's getting ready to exit jail, the better the outcome will be. So some of those opportunities that we were able to move forward with is a grant we have through the Centers for Disease Control and Prevention. It's called Overdose Data to Action, OD2A for short. And basically what it is, it's a large grant focusing on reducing both fatal and non-fatal overdoses, and really linking all of the data we collect to making sure we're making that data actionable. So a few of the strategies that we employ using that grant is funding a few patient navigators at CHS to do education, appointment management during and post-incarceration, and also linking with community navigators. We also work with the Human Services Campus Keys to Change campus to employ through OD2A a navigator that works with someone leaving the jail at CHS who we know is leaving without a place to go to work with that the Keys to Change campus. Another grant out of Public Health is through our South Phoenix Healthy Start program, and they've done a lot of innovative things working closely with Estrella. And a couple of those things include case management in the jails for both men and women. Something we're especially proud of is the doula program that they started in the jails. This is the only person that is allowed with the woman as she's giving birth, and this person stays with the person both prior to her giving birth and then postpartum. A newer program that we're very excited about is we're making sure that the men aren't left out. And they're doing a lot of work in the jails with new dads and trying to get them ready, especially as they leave jail, to be a partner who is available to the child, providing parent classes. And through another grant, we were able to offer South Phoenix Healthy Start a reentry coordinator. So upon release, they're supporting moms and dads with case management, with support in those few months after they leave jail to make sure that they're on the right path. So I'll turn it over to Lisa to talk more about release.
Thank you, Janine. So, when it comes time for release from custody, it's a joint effort, and you're going to hear us talk more and more about the collaboration that it takes to get folks at the point of release connected. So, one thing I think it's really important to note that if the court feels that someone needs to be released directly to a case manager, the court will find that in by court order, and MCSO CHS partner to make sure that connection actually happens. But that does fall to the court for their decision. Those are convenient for us because that does allow us a little bit of time to make sure there's a specified time. We can make sure we coordinate medications and also release, get that whole kind of coordinated true warm handoff to someone from the community. Another thing.
Question: how does
Sure.
the courts, how do they come up to those choices? Are those recommendations from something else? Because I'm looking at the court trying to figure out how they are the ones that make that choice.
I
Help me with that a little bit.
Sure, I can touch on that briefly, is the courts are increasingly aware, they're very much part of the sequential intercept model. Both Superior Court and some of the other justice courts around have got specific mental health courts that handle criminal charges and adjudication for those who are do have mental health and co-occurring disorders. So they're quite involved, and they will speak with defense counsel and obtain records and want to be aware of someone's status. Also, the court is involved if there's a civil confinement. So if someone needs inpatient treatment for mental health once they leave custody, then the court's very involved in that from the beginning. But it does take advocacy. So, but there's definitely a movement and awareness in that realm. With our public health partners, we also, for those who have been on withdrawal protocols, which I've shown you through those intake process for an amount of time. So resource, we don't have full funding for it, but when we have it and we've got funding and grants through public health and CHS, we provide naloxone for those at time of release. So to help, hopefully, once they transition to the community, if they encounter something, that they are equipped to respond. The other thing, we've got a community partner, Community Medical Services, have 5 navigators who, I just learned this in preparation for this presentation, will call intake at ITR every weekday morning at 4 a.m. and ask for a list of those who are going to be transitioned back or released from custody. They will then kind of review and compare their lists and do what they can to also intervene after that point of release and be able to provide services and help with transportation at that time. So, thank you. So I say all of this also because now we're moving into Intercept 4, which leaves the jail. Folks are leaving the jail, and you can see all of this effort that we're able to make once, while people are in custody, and then now what happens at the time of release from custody. So we are quite excited to share this project. So of those who are not the high need, so we've got a high success rate of linking with folks who are, who've got, serious mental illness, everything else. What about the other folks who are leaving custody? What happens with them? So here we've got the ITR, and we have partnered with Solari, which is, and they've got a coordinated release project through Mercy Care. So we didn't have data yet to know what services are people looking for, how many people are going to engage. So for us to ask for resources on this and what we needed, it was very challenging for our coordinated departments and the community to say exactly what was needed and by how many. So we are very excited about this Solari project. This picture is a van that's parked out at the ITR. It is not staffed 24/7 yet, but this is we're in the infancy of this project, mostly to identify what volume we're looking at for folks who would engage and what they're looking for. So,
Are you all familiar with Solari? Okay.
No.
Okay. Sorry. Solari also, they do many things in the community. Most notably, they run the 211 system in the community. They also are responsible for all the crisis response statewide in the community. So all the crisis calls that come in go through Solari. So they've got really a deep knowledge of resources in the community, services in the community, who's doing what. And for this particular project, Solari works closely with the Regional Health Behavior Authority, REBA, and for Maricopa County, that's Mercy Care. So for this particular project, Mercy Care is funding Solari to do this on behalf of Maricopa County, and Solari is contracting with Community Bridges to actually do the work, because Solari doesn't do, they don't have staff to be boots on the ground. because they do call centers, they do a lot of the behind-the-scenes work, but because of their relationships with crisis and with all of our service providers, they're able to work collaboratively with CBI, Community Bridges to do this project.
So we're excited to share, with permission of Solari, that we do now have some numbers to look at. So this is the future of what we may be looking at. The numbers aren't large, I will say that. You'll see perhaps in August we had 300 people engage. I just want to qualify again, it's not 24/7, but we are very, very pleased to have had that many folks engage.
One of the reasons for that may be the fact that other people are getting other navigation services. So these are the people who have perhaps lower needs, but still have needs. So I was astonished that it was 300, so good for you guys.
Thank you. We're pleased with the numbers. We're excited to see some of the data. The second piece of this slide, I apologize for the size here, is the time of day that people are engaging. So another thing that we find challenging is having community services that provide 24/7 services. We do, the folks are released from custody 24/7. And so we're interested to know what time of day folks are engaging. No surprise to me that, right now with our heat and everything else, folks are engaging middle of the day, maybe looking for water or information on how they can transition. The other thing that we're capturing is the age of those who are engaging, so the different age categories. Also, this is fairly consistent, I think, with the incarcerated population, just the percentages and the ratios of who are engaging. This is my favorite one, is the next one, is what are people looking for now when they come out? So you'll see that primarily people are looking for meals, housing, and transportation. So no surprise, but we didn't know to what volume or percentage that was. So this is going to help us in the future target those community partners who can help us link with those services in particular.
And in fact, after seeing this data, Mercy Care was able to find some additional funding. So now we're piloting, including transportation. So as you know, it's very difficult to find transportation leaving the ITR. So they're experimenting with some different models, primarily with Lyft, to help people get to where they need to be, whether that be home if they know where they're going, to the campus if they don't know where they're going, or to additional transportation. Sometimes people just need some transportation, a light rail or a bus stop.
So I think also to Janine's point, what we're looking for is this to expand. So this is the first steps. We're excited to have data. The data is how we can then advocate for resources and where those resources should come from. But we wanted to get this to the committee so that you could see tangibly really some of these questions that we've got, some of the challenges that we've got, and where we'd like to see expansion of services.
In this final slide, this is nothing new to any of you, but there's not one agency that can cover reentry. Everybody has a vested interest in reentry, and everybody has a role to play in reentry. It's just incredibly challenging in a community as large as ours to make sure everybody is aware of their role and is taking on their role. So this is just an example of the agencies that we know have an interest in a successful reentry.
Any questions we can answer? Any questions we could answer?
This is appreciated. And the 24/7 that you mentioned, would there be some that might be released in the middle of the night?
Yes.
And from other conversations, I know there's a lot of effort in trying to help them get ready and resources and so forth. Are there some that might be in the middle of the night that have no resources, have no one that is there to help them, and instantly they're homeless and they don't really have anyone to help them. Does that happen?
Yes, it could happen, certainly. The populations that are connected are really those ones with, with these high needs. And so there could be individuals who are released from custody and then don't have, they could have been arrested in one of the outlying cities. And then, there's the challenge of getting back to that city to try to reconnect if there's family there still or not. We want those connections to happen because for anybody, because the longer someone may be incarcerated, the more at risk those family supports, community jobs, ability to participate in society, mental health, those types of things can be challenged. So we would like to see everybody be able to reconnect with their services and resources, which may be in outlying districts.
And with the group of Solari, if I had been incarcerated and I was released and they're right there ready to help me, I guess at that point I still have my agency where if I don't want their help, I could just keep walking. So they're just there as a resource to help, and hopefully that individuals would take advantage of that. Is there, maybe just one more question, if I am about to be released and people have been working with me and it's known that I have no family, no one to go to, no job, no place to stay, I'm going to be homeless, is there anything legally that could cause our system to say we're going to keep you a little bit longer and try and help get something ready for you so that it'll be higher success?
Unfortunately, no, because it's incarceration. We've even asked the question, could someone voluntarily stay? And yes, the answer is no. Those are legal questions that I'm not the expert to answer, but this is, an involuntary incarceration and setting. And so then once the court has determined that it's time for that individual to release, then that needs to be done expeditiously. I wanted, if I could, one other observation that Janine shared with me, and I'll pass it to you, something else. The observation from the Solari group is sometimes people will be released a first, a second, a third time and not engage. By the time that's maybe the fourth incarceration and they're leaving, then they're saying, wait a second, what is this? What are these services? How could this help me?
And we had a similar experience over heat season. So as you might know, we had cooling centers open throughout the county. And in a few of our cooling centers, most notably with City of Phoenix, Community Bridges sat at the cooling centers almost 24/7. And they had the same experience where people were coming in day after day, week after week. And maybe those first couple of weeks, they didn't want anything to do with the staff at CBI. But maybe that third or fourth week, they were finally getting people to move along the continuum and finally able to get them open to accessing services. So we felt like that was a great unintended consequence of opening these cooling centers, that people were seeing the same caseworkers over and over again, building rapport. And at last count, Phoenix had gotten about 250 people into services that probably wouldn't have been if not the cooling centers.
To the committee, other questions or comments?
Okay,
Dr.
can you hear me?
Please. Yes, please.
Yes, thank you. There's that exact phenomenon that you're talking about, Janine. We've seen it with the city of Phoenix and in their efforts to try to link people with services and leaving the zone, that it isn't always on the first engagement, but often after a few different engagements with that kind of consistent approach, people will accept services. And I just want to say how exciting it is to see the Solari project. My question is, theoretically, there is the possibility of taking the information in what's being done inside with CHS and public health, the connecting services that are being done with Solari, to take that information and then examine it if there were sufficient staff to look at the impact on recidivism, correct?
Correct, yes.
Thank you.
Thank you. Any other? Don, did you have another one? I still see a hand up. Okay.
I do.
I just
Can I
want to,
Go ahead.
sorry.
Go ahead.
I just want to say how exciting this is. And it actually does feed into a couple of questions we might have later on around, is it the best use of putting Solari out in the middle of the public parking lot in 115 degrees? Should we be building or thinking about building a shelter permanently for them and to actually have air conditioning and some space? So just food for thought, very exciting. And that would be 3,600 people on top in a given year if the 300 keeps holding. So congratulations.
Thank you. Ryan?
That's not too far from what I'm just trying to structurally see how this works, that someone leaves ITR and there's a van outside that you're hoping that they engage with. And it's a great program because we have to, one of the things we should try and do is prevent the recidivism rate. So why isn't this part of the release in a more structured way? Why isn't it in the facility where they say, okay, now you're out, go see Brian in the room over there and he'll hook you up with these types of resources versus having it be outside in a van and they can walk past it and don't engage? Why isn't there more of that's part of the release? And if it's because it's funding, well, that's why I think we're sitting here to figure out how do we add that to the funding mechanism so that you have more funding to provide these services outside of Solari. So that's my loaded question.
I think you're absolutely right. That is the question that we are trying to answer. And so that's, for example, Yavapai County has just built a kind of a release center there, brand new. So interested to see what their data and success shows. We actually traveled, a group of us, to Albuquerque to see their release facility. Also, so to answer these questions, but we didn't have data enough yet to know what services we needed to ask for resources. And then in our structure with Maricopa County and the multiple cities that we service, where is the responsibility on the resources there? So those are some of the questions that we've got. There are other questions that we can overcome, things like security and whatnot, and transportation, but the complexities of this Maricopa County area, given the number of cities, is something that we're trying to address, and that's where this data is, we're hoping, going to be critical for us.
Okay, let me retort, because all those cities are in Maricopa County. So I would say, what difference does it make? Fund it. Don't say, well, Phoenix needs to come up with it because there's more of these places in Phoenix, or blah, blah, blah. Why don't we just fund it as part of the detention fund as a service on the release of, incarcerated individuals that are falling through the cracks otherwise? I'm sure you're not the one that's going to answer that. Maybe we are, right? So
I think it's important to know that this is not a sustainable program. It is scheduled to end next year. Mercy Care just put some money in to pilot it to see kind of what it would look like. I think another challenge for us to look at is, because the valley is so spread out, let's just talk about brick and mortar. Do we build one brick and mortar, most likely in Phoenix? And with us so spread out, is it doing a disservice to everybody on the outskirts? Because now everybody's kind of stuck at that reentry facility, knowing that the large portion of people coming out don't have any place else to go. So then there's just things, there's lots, I think, of things to think about, because our housing is so limited, and that's, we don't have a ton of extra places to put people. So if they're coming out and they have no place to be, and they're stuck at our reentry center because there's no housing. We just, those are things I think we have to think about, is where we put people who come out and are now at our reentry center.
Barbara?
I think it's important to note that this is really a pilot, and you finally have some data that is very supportive of thinking about with cities and with community partners and with Mercy Care, quite frankly, that this is a viable and necessary program. So I think the issue really is having it and showing the data and getting all the partners together to figure out how to fund it.
And it could be it or them. I mean, it could be like a hub and spoke too. So I think there's a lot of ways we could look at it.
To the two of you, I should say, to the three of you, thank you.
Thank you.
We move to agenda item number 7, our Public Sector Performance Associate team. And traveling from, last time it was virtual, this time from Florida and California. Thank you for making the efforts. Monica and Sam will turn to you for part 2 of the report.
Thank you, Mr. Chairman. Thank you. Thank you, Mr. Chairman, and thank you very much, committee members. It is a great honor to be here to deliver part 2 and actually the entire report. With me here today are in present Sam Yin, and online I have my other team members, Stuart Griffel, Kathy Brown, Robert Sullivan. I believe Becky Testing was on the road today, and Norma Barrios is still in a shelter. She's in Tampa, Florida, and she was under a lot of water there. Last week, 2 weeks ago, we were here to present part 1 of our report. We shared with you the results of our evaluation of 3 of the 4 agencies that receive most of the detention fund, plus 1 chapter that discusses alternative funding mechanisms. Today, we will be covering the 4th agency, the Maricopa County Sheriff's Office Detention Operations, as well as 2 additional chapters, one on recidivism, observations, other performance measures of success, and a last chapter called Current Trends and Future Needs. Just a recap on what we were hired to do. We performed an assessment of public safety funding information for your committee, the purpose of which was to offer a comprehensive analysis of public safety services provided by Maricopa County and paid for by the detention fund. The scope of the work included the 4 agencies that received the most detention fund monies, which are adult probation, juvenile probation, correctional health services, and the Maricopa County Sheriff's Detention Operations. We also touched on those smaller agencies, if you will, that receive about 6% of detention fund monies, including organizations like the Superintendent of Schools and Maintenance Operations. The specific objectives of the project was to identify mandated and non-mandated services, mandated and non-mandated expenditures, to understand the cost associated to providing those services, and look for some ideas for improvement. We also look to examine the long-term financial sustainability of the detention fund, considering factors such as the expiration of the jail excise tax, expenditure trends, and alternatives for funding. Other models found in other Maricopa County and other Arizona counties and in other western states and counties. Our team conducted numerous interviews. We did walkthroughs of the facilities. We analyzed tremendous amounts of data. We evaluated just about 50 services and many statutes, laws, court rulings that enable the provision of those services. We also conducted a limited inquiries with Arizona counties and the western states, all with the purpose of looking for those alternative funding mechanisms. that could be adopted in Maricopa County. We, like the last time, we want to acknowledge the support and assistance provided by the 4 agencies, their management and leadership. We're also very appreciative of the help provided by the county's Budget and Finance Department, as well as the County Supervisors Association of Arizona for providing us access to relevant research. We also appreciate the help of the coordinator of this committee, Danny DeHoog, and the co-coordinator, Paige Gonzalez. So with this, I will pass it on to my partner, Sam Yin, to talk to you about our assessment of the Maricopa County Sheriff's Office detention operation.
Good afternoon, everybody.
Green.
Testing. Good afternoon, everybody. Thank you for having us here in person. I'll go ahead and start with the chapter that we missed last time. In the packet that you guys were provided, it'll be on page 31, chapter 3 for the Maricopa County Sheriff's Office. So to start off with, Maricopa County's Sheriff's Office is the 4th largest sheriff office in the nation. In 2023, they booked about 81,000 arrestees. But focusing back on our tasks, the main funding source of MCSO's custody operation is the detention fund. It accounts for about 55% of their total budget, which is roughly $276 million out of that $504 million. As with any other local jails inside the United States, they have to fulfill the mandates that they're accountable to, no matter what constraints they have. For Maricopa County, they run a total of 7 jail locations, managing those facilities, which include Lower Buckeye, 4th Avenue Jail, Watkins, Estrella, and ITR, the intake facility. Within it, there's an average daily population, if we're counting in 2023, of roughly 6,780 inmates. That includes both pre-trial and pre-sentence populations. If you look at page 32, we see the breakdown of the inmates, then their daily average populations in the individual jails. Moving on, when it comes to booking, when we analyze booking, we do see a net decrease of about 14% over the last 5 years, coming down from just over 94,000 in 2019 to 81,000-ish in 2023. But as you look at the graph on page 33, I want you to take note that 2020 was kind of an anomaly year, as we all know, COVID-19. There was a lot of changes in law enforcement throughout the nation, as well as a lot of different judicial outcomes. But in looking at that, I also want to emphasize that there has been a continued trend upward since then, and now we are approaching back to the numbers prior to COVID. The average daily population, as we look at it a little closer in the last 3 years for pre-trial and pre-sentenced adult populations, remained pretty stable with just a slight uptick. The graphs are shown there on page 34, and the breakdown between the 2 types of average daily populations. The length of stay, though, has shown quite a bit of change. The average length of stay from 2019 to now has dropped from about 146 days on average to 71 days. If we look at it a little closely, this is likely due to sentencing and the courts. This is not something that the Sheriff Departments have control over, really. And looking at the Sheriff Department as a whole, they do provide a full range of service from intake, booking, release, housing, medical services. The list is provided to you in your report starting in page 36 and onward. But I want to highlight something that was brought up from the earlier presenters, transportation. So once they're inside the system, just to give you an example, in 2023, there was over 96,000 transports conducted. And it's a big job because it's a big coordination between, the nursing staff, the courts, the detention staff that does the transportation, the vehicles, the security, so on and so forth. So these are the things that the funds are used for. And when we analyze the mandates itself, without going too far, there are a lot of laws, statutes, and rulings over the years that set precedents that exist requiring these mandates. To isolate two of them, the first one really is the Eighth Amendment, which addresses the conditions in which they have to be incarcerated in, right? But supplementing that, there have been Supreme Court rulings specifically to Arizona, Hart versus Hill and Graves versus Penzone over the years, which really emphasizes and affirms these, the rights to prisoners to have adequate housing and care. Most of MCSO's custody services are paid by the detention fund, as I mentioned earlier. Some services are only partially paid. So for that, I refer you to page 42, specifically service number 7 and 8, to kind of highlight the importance of these non-mandated services and how it kind of integrates with the mandates that are required. So service number 7 on page number 42 is the Custody Bureau's Intelligence Unit. Essentially, they gather and analyze information which assists the detention officers in keeping their facilities safe. It is not mandated, but it definitely supports the mandate to keep, care for the inmates. The next one is the Special Response Team. The Special Response Team, they're the guys who go into high-risk situations. They have to extract or move inmates from cells or locations. These are critical incidents that, normally if you don't have a specially trained team, it can really ruin the workflow of that day and put a hamper into the operation. Moving on into the cost analysis, we give you a breakdown on page 44 of the primary services and what the costs outlays are. So looking at page number 44 in that table, inmate housing is by far the largest expenditure, a little over $105 million, which is about 41% of the expenditures for 2023. Again, when we move forward and we look at these percentages, you got to be real careful, because when we're looking at trends, we see a giant uptick based on the time period we're analyzing. But just to note that in 2020, the CARES Act and ARPA funding provided some relief, which was used to basically, add to what the needs were, thereby decreasing the actual detention fund. So when we look at the numbers, it's really deceiving, but in reality, although it has gone up or increased in expenses, it's not as much as it looks, okay? To give you an idea, there was about 41 million added or assisted into the detention fund. I'm gonna go ahead and go past CHS, since that was covered last time, and move on to page 59 on chapter 5 under recidivism. Any questions so far?
Chairman, I have one question. When you looked at length of stay, I noticed that pretrial has gone up pretty dramatically from 20 days initially to 32. And since the larger population is pretrial, that seems pretty dramatic.
It is. I like to say that although I'd have to look a little bit deeper, but a lot of times based on the pretrial length of stay, it has to do with the court's ability to go through all these cases. And there's a large amount of booking and there's a backlog in court, then they have to stay a little longer prior to trial. And that also includes inmates who have a history that requires them to stay inside the jail facility versus being out right away. Anybody else? Okay, moving on to chapter 5 on recidivism. First off, we have to define recidivism and what it really is. In layman's terms, it's basically folks who relapse into committing offenses. That's essentially recidivism in a nutshell. So the most common measurement of recidivism that's used by most departments is being rearrested or violating probation within a given period of time. Most departments either count from 6 months to about 2 to 3 years. A lot of it has to do with the logistics of keeping those types of records and tracking that data. As far as Maricopa County goes and the departments that we took a look at, what we observed was that the adult and juvenile probation departments do track and report measures of recidivism. Maricopa County's Sheriff's Office does not. However, it is not uncommon to see that throughout the nation. And that's because of the constraints of systems and their ability to communicate. Basically tracking systems when someone is booked, if they reoffended, if they went through court, if they got reconvicted, and also the personnel required to track this stuff. Adult probation for Maricopa County tracks two measures of recidivism, essentially the percentage of individuals that are revoked to prison while on probation and the percentage of individuals that commit new felonies during probation. On page 60, we give you the chart of those rates there. So adult probation continually evaluates its practice and risk reduction strategies to promote positive behaviors and make the necessary changes or tweaks as needed. Juvenile probation, on the other hand, tracks or measures the frequency in which an individual reengages into the criminal system. The way they do it is within a 365-day period after the completion of their probation. If they reoffend, in this case, they count rearrests, it's tracked. It's generally tracked up to the age of 17 currently, and that is because the system is tracked differently once they turn 18, and when we were talking about 365 days, and they'll be 18 and kind of fall out of their tracking system. So here's where I get to in our mandate here, is that Maricopa County has an opportunity here. And the opportunity really is for the county to establish its own parameters of recidivism. This way, you can go and in the future, look back at the data, look at the trends, and see what needs to be changed, what needs to be modified in order to get, a more efficient outcome. This is going to require leadership within the county and the different departments and communities to come together and agree on the metrics. Either you decide 6 months, a year, 2 years, how you're going to look at recidivism, whether it's reoffense, rearrests, or reconvictions. This is your opportunity to do so. It does take a lot of work because it does take a lot of collaboration, but once that's established, it can be benchmarked and compared to other similar agencies to see, how you guys are doing here, how they're doing, what changes were made there that were successful, and what changes that can be made here that can be successful. Because every community has a different population type and need. With that, I will go ahead and actually, any questions before I pass it over to Stuart?
I have a quick comment, Sam.
Go ahead.
If I may. And we learned this just a few days ago. I just wanted to add to what you say. The juvenile probation department historically was tracking recidivism while the youth were 17 years of age or younger, but now they are able to report on reoffenses that occur after that age. So that was a recent development. We were able to add that. So.
Okay, cool. I'll pass it on to Stuart for the.
Beyond 18, so
Okay, thanks, Sam. Can everyone hear me?
Sorry. Okay.
Yes.
So what you're saying is that they can track that beyond 17 and 8. So
Beyond the 17-year-old limitation. So now they're able to track that past that threshold.
yeah. So my perspective is, if they're 19 and they reoffend, that would count towards a recidivism from when they were a juvenile, and it counts to that number, or is that what you're saying?
That I do not know. I do not know the specifics. We just know that that was a kind of a constraint. They were only able to track 17-year-olds or younger. But now with the changes that they've made, and we don't have the details of the mechanics, but this was just a couple of days ago, they were able to track those after that age.
I'm assuming they're only tracking what's going into juvenile court and not necessarily what winds up at 19 coming into adult court.
Correct, because the way the database is kept, once they are adults and they go back to court, they're recorded in a separate system that juvenile department doesn't have.
Okay, I think you introduced Stuart.
Yes, Stuart,
Stuart?
please go ahead.
Thank you. Mr. Chairman and committee members, in this section of the report, we also discuss the lack of different types of performance measures that could quantitatively, and I emphasize the word quantitatively, show the success of these four agencies. We found for the most part that agencies mainly report on output measures, which indicate how much is being produced. And reporting outputs are fine, but other measures need to be reported so the reader gets a more complete picture of how the agency is performing. That means that outputs need to be linked to costs, outcome, and staffing. As one of the opportunities for improvement in this section, we suggest that, when applicable, the agencies consider developing, tracking, and reporting relevant performance measures, including cost efficiency and effectiveness, such as the percentage of individuals that completed a drug court program and were found to be drug-free a year after program completion. We also suggest that agencies should consider, when necessary, conducting workload analysis and/or staffing studies. Finally, whenever feasible, the agency should benchmark operational results, service expenditures, and/or per person costs to similar counties to assess comparability. Contacting other counties and consulting with professional associations are often good ways to identify relevant measures and better or best practices. Chapter 6, which is current trends and future needs, on pages 64 through 79. This section of the report shows the financial and staffing trends of the detention fund and 4 agencies over the past few years and projects 5 years into the future. The pie chart on page 65 shows that over the last 4 years, the average of approximately 51% of detention funds were from the jail tax and 44.4% was from the general fund. The bar chart on the page shows that over the past 5 years, jail tax revenues have increased as well as expenditures. Now, if the growth rate trend of revenues and expenditures continue through FY26, as they have over the past few years, there should be no need to move additional monies from the general fund to the detention fund to keep it in balance. Now, as the chart on page 66 shows, the fund will stay in balance until midway through 2027, and then there will be a $2 million deficit followed by much larger deficits in future years. Page 67 shows detention fund expenditures for each of the 4 departments and other smaller departments that receive detention funds. It also shows for the 4 departments that we've looked at in this review, how much of their expenditures go to mandated administrative and non-mandated services. Page 68 through 72 provides a high level as well as a detailed picture of the significant cost drivers and their changes over 4 fiscal years. The bar charts and text on these pages discuss total and disaggregated expenditure trends for the 4 agencies in the categories of personnel, services, supplies, and capital outlays from fiscal year 20 to fiscal year 23. The main drivers of personnel costs over these years have included medical expenses, workers' comp, unemployment taxes, subsidy plans, and retirement expenses, as you can see in the bar charts and also the discussion on these pages. Page 75 shows the projection of an average 3% increase in detention fund expenditures between FY25 and FY29. Pages 76 through 77 shows a 6-year view of the number of full-time employees of the 4 agencies and the top 5 positions paid by the detention fund. And the final part of this section on pages 78 through 79 discuss consideration for future financial needs based on future jail population and the related expenditures and revenues that cover their costs. It also provides examples of growth trends in key services paid for by detention funds in the 4 agencies. Finally, these 2 pages discuss the factors that have and will continue to affect future funding of detention and probation services. Any questions?
I don't see any hands or comments, and I get the sense that we're going to need to spend some time diving into it and studying it.
Yeah, there's a lot of information in that section.
Thank you, Stuart.
Thank you.
Thank you, Stuart. And the last thing we would like to do is to take your attention to the executive summary. So here we represent 8 items that we believe can, first of all, summarize the extensive amount of information and results contained in the report, but also we believe that these are elements that can aid the committee in this process of evaluating and planning the financial needs required to continue to provide these services in the long term and also to contain costs. So the first thing that we noted that was a theme that was developed as we interviewed and we got to know these 4 agencies is the emphasis that they put on inmate well-being and sustaining positive change. For example, even though the mission of the Maricopa County Sheriff's detention operation is to fulfill the basic needs of the inmates, food, shelter, transportation, to keeping them safe, they also put a lot of attention on programs that are aimed to changing behavior. Now, those programs are not paid by the detention fund; they're paid by the inmate services fund, but they're important. I believe that at the end of the day, the point of trying to change behavior and making those positive changes in the inmates will ultimately reduce cost of incarceration, because then hopefully if those good habits are acquired, then there are less chances of that person recidivating. So we noted that especially correctional health services, they worked diligently in trying to identify the root causes of criminality, hopefully, and stabilize the patients, and then trying to connect them, as the presenters earlier today, that aspect of making the connections with community organizations that can increase the chances of the individual sustaining the positive changes achieved during incarceration. We noted that, and we agree that it's a very important part of what they do. The second item is the fulfillment of the mandates. Based on our evaluation, we concur that the mandates are being fulfilled. And we also noted that the 4 agencies work to protect the county from potential litigation by ensuring that they are provided the health care and the detention housing services that help them meet the mandates. So one of the key things that you asked us to do was to determine if each of these services was mandated or not mandated. So we went through a process of analyzing the different rules and court actions that support and enable the different services. And we made that determination. And we found, at the end, we were able to quantify what those mandated, non-mandated, and mandated administrative services are, and we arrived at 80% of the expenditures are mandated services, 19% are mandated administrative type services, and which are functions, generally administrative type functions without which the mandated services could not be carried out. And then the non-mandated services represent about 1% or close to $6 million of the detention fund expenditures in fiscal year 2023. The third element that we identified as being key in this process is the fact that probation and incarceration populations are growing, and with that, expenditures are growing. For example, the CHS and the Maricopa County Sheriff's Detention Operation have seen an increase of 3% in the last 3 years, and that increase is sustained in 2024. For adult probation, for example, the population in intensive probation has also seen a 4% increase. And as another example of the services that they provide, which are pre-sentence investigation reports, have seen a 23% increase in the last 3 years and sustained in 2024. Now, these are just two examples of the various services that they provide. Juvenile Probation Department, their total referrals have seen an increase of 18%, and the unduplicated number of youth detained 8%. So definitely a growth pattern in the population served. And when we look at the expenditures, they have increased according to that. And forecasts produced by the county's Budget and Finance Office indicate that there will be a 3% detention fund expenditure increase through 2029, as my partner, Stuart, was explaining. The next item is the dependency that Maricopa County has on the jail excise tax. Definitely dependent on that. So we were able to confirm that through our study. And as we know, the jail tax is set to expire in 2027, which, as Stuart was explaining, can create a significant funding gap. Along with that is this analysis of alternative funding mechanisms. Our research found that only if there is legislative intervention, the funding mechanisms in Maricopa County are limited, and there are really no options. And that is due to different constraints that are applicable only to Maricopa County, for example, the population size that we have here. We also found interesting funding mechanisms in other western states and counties, but again, as you read the details in the report, those would not be implemented unless there is legislative intervention. You asked us to look for key factors impacting funding. Definitely, changes in policies in the future can affect funding, as does behavioral change, as do societal changes. So truly, in order to quantify the effect of those factors is a challenging thing. For sure, there are two key elements that are impacting and will continue to impact funding, and those are the opioid crisis and mental health crisis, and the challenge to hire and retain qualified personnel. As we know, the Maricopa County Sheriff's Office has reported a total of 840 detention officer positions vacant, and research confirms that that is an issue not just for this county, but throughout the nation. The Sheriff's Office, however, is developing and implementing strategies to close the detention gap, the vacancy gap, sorry. The next item mentioned earlier today are measuring recidivism. We believe that there is value in starting to track and report recidivism data. It is a tool that can help programmatic decisions and to better inform public safety outcomes. As Stuart was explaining, we did note that the number of cost efficiency measures are limited. There are lots and lots of results reported, but mostly in terms of results. So it's important to track and determine how much these different services are costing, how much the per unit cost is, in order to establish goals for cost containment and, in some cases, even cost reduction. And those are the 8 items that we feel summarize the work that we have performed for you.
To the committee, questions or comments?
I have a go back, I'm sorry. Back to page 61. I just want to understand the recidivism, the juvenile to adult component here, because I just don't understand, right? So if we track juvenile recidivism up to the age of 18 when they become an adult, right? Under 18. So if there's a juvenile that's been in the system and then turns 18, they start over? In other words, if they offend after the age of 18, do we consider that?
Essentially, it's just not tracked by the Juvenile Probation Department, that's it.
Okay, I think that's what I heard you say.
Yeah.
So under this paragraph here, there's a opportunity for improvement.
Correct.
Couldn't we try and make an opportunity for improvement to track that better?
You can, but outside of this report, going back to Arizona state law, there is a statute that allows for a juvenile, once they turn 18, to petition for their records to basically start over. And so unless the Arizona state law is changed or modified, then you can do that.
Okay.
Go back to page 4 of the executive summary, and both of you mentioned this, that county leadership, this is under number 7, should consider establishing clear definitions of recidivism and other success metrics tailored to the various populations. Other counties in the United States, do they have clear definitions and metrics that we'd be able to compare to, or is this a common problem in most counties?
Every county has their own, and so it's what they've decided. So for example, some counties count only folks who are sentenced and resentenced, considering recidivism. Some count rearrests or reoffenses as recidivism. Essentially, the viewpoint is some believe that until you are convicted, then it's considered you're guilty of reoffensing, while others view it as, well, if you're out and about in the community, and a year or two later, you are now engaged in an activity where it requires law enforcement to intervene and put you under arrest, you've committed an offense again. So it's something that's established by the county leadership to choose to count. Yeah.
And as you've been interacting with our county leadership, will this be a really hard thing for us to do? Or is it just a matter of taking the information and coming up with those definitions?
We like to think it's the latter. Our understanding is that there has been an effort to do this in the past. We don't know how far the process went, but it can be done. It can be done, and we're presenting information, and we have some PowerPoint presentations from both counties that we found that were tracking, local jail systems that are tracking and reporting recidivism, that we will make available to the agencies to give them some ideas to get this process organized.
Thank you.
Chair, in my former life as Chief Adult Probation Officer, I've been involved with trying to come up with commonality for recidivism. This one's even more complicated because probation is a part of the judiciary, and we report to the state in terms of definition. So it is an engagement that not only requires county leadership, but the court leadership and also the Supreme Court. So it's a little bit more complicated for us at a county level, but it is doable. And that's why I'm happy that your recommendation kind of mirrors our recommendation. So that's very good, but it's not going to be easy.
No, it won't. I think the biggest challenge really is the collaboration of not only the different entities, but also the databases. There are a lot of databases, and from our conversations with the leaderships of the department, the real bigger issue is if someone travels outside of the county limits into a different database, offends, comes back and reoffends within, how do you accurately track it? Yeah.
Thank you for this information. And we will be hoping that all goes well on your return trips. They will.
Thank you, everybody, for your time.
Thank you very much for having us. Thank you.
I'm going to turn to our executive director for just a moment. We had talked about going from 7 to 9 to 8, but should we continue on and go to number 8?
Yeah, I think we should keep the order. I
Okay.
think we have enough time to get through it.
We'll move to agenda item number 8, a presentation on the economist preliminary comments from Luis Cordova of Rounds Consulting.
Mr. Chairman, committee, thank you for having me. My name is Luis Cordova, Vice President and Economist at Rounds Consulting Group. And so I'm here today to provide just a high-level overview of the analysis that we'll be conducting related to the jail tax extension. So as far as the scope and the key topics that we'll be analyzing, we'll be looking at the current jail tax revenue and uses. We'll be looking at evaluating alternative funding sources, and with the main focus of analyzing the potential impact of those alternative funding sources. And I'm also going to share a few high-level insights that we've already discovered. So what's at stake without extending the tax? One of the big issues is, we'll be losing a stable revenue stream. So how do you make up for that? That could lead to potential tax increases or fees, or you're redirecting a lot of funds. So it would lead to, diminished public safety and other essential services, including, road maintenance, economic development. And then there's also a risk of just creating an inefficient government. So because you would lose this tax revenue, you would have to manage that. And how do you relocate funds? What kind of cuts do you have to make? So it would just create a lot of inefficiencies. So just to start off, so what are the alternatives? I would say one of the easier ones to do immediately cover costs would be redirecting funds to cover the mandated jail costs. And again, so that'll harm the county's budgets. It would limit resources that are currently available. It'll degrade public safety and decrease the quality of service for other essential services. So another option is tax and fee increases. So from there, that there could be a property tax increase, which puts the burden on the homeowners and businesses within the county. And this leads to, the region being less attractive to new residents and business expansions. Another one is increasing fees for essential services. So again, you pass the financial burden to the residents and businesses. And lastly, another option is creating special taxing districts, which these are very complex to manage. They're complex to set up. They can have uneven financial impacts on residents, and they're a less efficient mechanism. So why does this matter? We know a lot of things impact economic growth, and there's a lot of different factors that influence, the county's potential future growth as well. So, there's a number of things that that make the economy tick. So, creating an imbalance in one area could have, very negative effects. So when we're looking at the impact of what that imbalance could create, there's currently an efficient system with the current jail tax. So that's created stability. And, when businesses are looking to come into the county or considering expanding, they want that service stability. So that could lead to, making the region less attractive. The other one is inefficient taxation. So, reducing costs somewhere else or having to raise costs in, other areas also, makes an inefficient system. And the current system is really a pro-safety, pro-growth approach because it indirectly impacts public safety. With having the right jail facilities, you reduce, a lot of those like first responder effects. So the system is really, right now as it is a pro-safety, pro-growth system, and it builds, confidence with the local government. So that also affects, the county and the state's potential for economic growth. And with that, if there's any questions or comments, we are, I will say we just started working on this, so we don't have a lot more insights yet. And we don't have a timeline, but I'm sure we can update you on that very shortly.
Thank you, Luis. Questions or comments from the committee? So you're in the early stages, but you're off and running.
Oh, yeah, exactly.
Okay, great. Thank you.
Thank you.
We will move to agenda item number 9 and continue discussion. I guess we'll call it part 3 of possible action and some recommendations.
Thank you, Mr. Chair. And committee members. After our last meeting, and this is part 3, Danny and I decided to go ahead and put this in a PowerPoint now, and we're going to present it to you like we would a bill. So the things that are new are going to be light blue, and you'll see this slide is all new because we listened to you all last time. We went through all the documents previously and added important items to you, like community linkages, leveraging community partnerships, working on prevention. So hopefully we are closer, if not there, on these items, and you'll be in a position to vote on a draft today before our public webinars. But I'll go ahead and get started. This is a new section that we restructured on reentry, community services, and coordination. And I can read through all of this or just give you the highlights, Mr. Chair. What would you like me to do? I'll just give you the highlights.
Go highlights.
Okay. So we started it off by saying it's a whole new title, whole new section, that the county should pursue opportunities focused on leveraging existing community partnerships. Then we list out the agencies that are inside the county that can work together: workforce development, human services, public health, the education service agency, on coordinating data efforts. Also, fostering linkages to implement prevention strategies that would effectively promote community health and safety, And then finally, these linkages could be expanded beyond prevention into transition out of detention. I was going to crosswalk all of these with all of you and what you said, but I feel like you all know who you are, so you know which ones were important to you. And then slide 2, do I have it? Sorry. So then slide 2, again, the blue part is new. After you all heard the discussion about the Medicaid waiver exclusions, we added this section about noticing that this would also help with transition and accountability and data tracking and data sharing, and where the state and county can work together to share information with better outcomes for those released. And then lastly, one of you had asked, what's the overarching problem here where our people are coming in and having this kind of turnover? And obviously it's come to, we need to strengthen our behavioral health system. So how can the county do that? The county can participate in efforts in prevention strategies there, early intervention, community support to decrease justice involvement. And then there's another section that you'll see later related to behavioral health workforce. But that's what we included here in this section on behavioral health. I'm happy to answer any questions. Okay, Danny will go next. We're switching.
All right. So the next section, so we now, as Paige said, have 4 sections. So moving on to programming court's recommendations. These are pretty similar to what we looked at 2 weeks ago. As Paige said, the kind of newer stuff is in blue. So we have stuff in there about maintaining funding for probation, trying to keep people out of jail facilities, and supporting diversion. So we did change the second bullet point a little bit. We did previously have that National Commission on Correctional Health accreditation in there, but we got a suggestion to also add the Substance Abuse and Mental Health Service Administration standards. So we changed that and added that one in there. The third one has been in there, so coordinating on that ITR at the initial appearance court with the city. So that one is in there still. And then the last one on this slide is engage in policy conversations about the appropriate placement for juveniles and coordinate on statewide policy changes to reduce the juvenile population in adult facilities. This will reduce unnecessary duplication of services. And so this is something that came up in our last meeting. I believe Dr. Nagel brought it up as an issue that it's costly, and so I think engaging in those policy conversations at the state level. So that's the one that's new. Is there any questions on the programming and court recommendations or any feedback?
Okay, the next slide is capital recommendations. There's only one change to that, and you'll see that's the very first bullet point. Some of you raised concerns about making sure that we understand what the focus is for this section, and understanding that there are limitations on detention fund uses, that the county continue to fund current services through this jail excise tax and through the detention fund. And it's crucial for covering the costs that enhance public safety and protect our communities.
All right. So on to data and long-term initiatives. So this first one actually was in capital previously, and as me and Paige were making new categories, we realized that looking at the jail master plan in a decade should probably fall under the category of a long-term initiative. And so we actually moved that one down a section, but it was previously in capital. So in the blue, you'll see a new one. So this is something Paige referenced earlier. So we added a bullet point. This ASU study, detention officer study, we've talked about quite a bit. But in our conversations with the committee, we realized that we should really talk about workforce as a larger issue. I think we know about the DO vacancy and the issues that are nationwide with that, but also adding in there mental health and substance use and behavioral health employees. And so we kind of just expanded that a little bit. Any questions on that one? All right, next one. Okay, so this slide was mostly the same last week, but we did add a couple of little things in there. So at our last meeting, we talked a lot about navigation, and then we heard a little bit about that today from public health and correctional health. And so we added something in this committee. So this is that long-term working group of getting the right people at the table to talk about a lot of these issues we've identified and trying to make long-term improvements to the system. And so we added the navigation services as something they should look at and the benefits of increasing navigation. And I think that kind of ties in with the conversation we had today about Solari and, how we can better increase reentry. And then we also added artificial intelligence into something that's an emerging issue on that fourth bullet. Any questions or feedback? Okay. Okay, so this is all new. So this is something that a committee member brought up last week. The idea of having something that kind of mirrors what they did in 1997, what they recommended, which was an oversight committee to look at how, if this committee recommends that this tax should be extended and the voters decide to extend it and the legislature allows us to take it to the voters, then having some kind of oversight committee to look at how this funding is spent. We did throw in a recommended membership based on kind of how this committee is set up. And then we kind of tried to put out some things, it should be public, they should meet at least once a year. They should get an update on your adopted recommendation, the status of the jail master plan, and the uses of the detention fund. And then any major changes in policy that would impact the fund or the justice-involved population. So that one is all new. So those are the recommendations. I would love any feedback or thoughts. Our intention is that if you adopt a draft of these today, it will become part of the public webinars next week so we can get public feedback. So whatever you all decide today would be considered a draft.
Thank you. And Danny, I'm just jumping ahead because it'll come back to a question to the committee. So we have our 2 webinars that will happen in a couple of weeks. And then we would meet formally as a committee again on Thursday, November the 7th. And that would really be our chance to talk about, and by the way, that was very helpful to see in blue, the new information. And today, if we do accept a draft, it doesn't mean it's final. It just means that we are giving a green light. We're saying okay to release that so the public can see what we're thinking so far.
Exactly.
Okay. So to the committee, how do you feel about approving a draft of the recommendations?
Well, Dr.
Don?
Yeah, if I can, thank you. First of all, I think that they do a very good job of capturing the conversations we've had. I hate at this late date to suggest this, so I'm throwing it out for us as a committee to think about. I'm wondering if, given the report that we just had from the consultants, I'm wondering if we can or should add language, and I think it would be relatively easy to add, suggesting that part of the capturing of data would allow for us to do some analysis of cost efficiencies. And I don't even know how to word that, but I think it was a very helpful suggestion that was made. For what that's worth. And I can live without that going in and it can be added later.
Okay, thank you.
Thank you.
I might turn to Danny and Paige on that. Based on that comment, what would that do to the recommendation page? And could a sentence be added with that feedback and the committee saying we approve the draft and additional language that would include cost efficiencies?
That's right. I would, if you wanted to do that, Mr. Chair, someone could make a motion and then say with the amendment that was proposed earlier or something like that.
All right, Barbara?
I'm not going to make an amendment. I'm going to point out in the long-term data, we have a statement that basically says establishing uniform measures and data, starting with recidivism. So it doesn't preclude us from moving into cost effectiveness. So I think the wording is broad enough that I would say we stand with this, because we first have to do recidivism. I think the consultants would agree with us on that, and then move into other types of cost efficiency measures. That's my thought.
Don, how do you feel about that?
Well, I think the cost efficiency measures go beyond just looking at recidivism, although that one is obviously very important to us. But I also I don't have a big stake in this, so I'm okay with whatever. So I'm sorry to be so wishy-washy, but
No,
that's
thank
where
you.
it's at right now.
And I think, Barbara, what I heard you say is you feel like it's there, and possibly, just throwing out options for Danny and Paige, you could look at it again, and if you felt like there was a phrase that could be added as a committee, we could wait and see that, but for today, we could still accept the draft.
Chairman, I think I'm probably being practical. I'd like to be able to have something that we could vote on today and not have to wait to see what the words are. And we were going to get the public input, so this is going to change. These are only drafts, and I think, Dawn, if I could, I would say let's put that on a parking lot and bring it back when we do the public meetings. Is that reasonable?
Yep, absolutely.
Okay. Thank you. Jason, I see your hand.
Yeah, thank you, Mr. Chairman. I agree. I think Danny and Paige have done a nice job capturing the committee's thoughts. I would ask if there's an opportunity to just confirm over the next couple of weeks as this goes through the draft process that the county agencies have had an opportunity to provide some feedback on those recommendations to make sure there's nothing in there that is infeasible to go on. I'm sure they've been paying attention as we've discussed these over the last few weeks, but I think that would be helpful to make sure that before we finally adopt and make recommendations to the board that that they're at least comfortable in the role that they're going to have to play in that if they were adopted. So, thanks.
Do we have a sense, some county leadership has been looking at this, and do the two of you have any feedback on comments that have been given so far?
So yeah, we have shared this with county leadership, and I think once the draft is adopted, we definitely can circulate it with, entities that are mentioned in here as well to specifically. But yeah, we have tried to share with our partners and, the folks that have appointees on this committee, especially what's going on. But yeah, once we have a draft, I think absolutely, Jason, we can circulate that and make sure that we get some feedback before anything final is adopted.
As we go through another round of circulation, if some county leadership came back that there are some challenges, would that be information that would be included in the meetings we're having, or would that just be something we talk about on November 7th?
Yeah, I think that on November 7th, we'll hear the input from the public, and then if there's any internal input, we can do that too, and then we can kind of have a whole nother discussion based on that, on any changes needed.
All right. Jason, thank you. Any other comments from the committee? With that feedback, I will entertain a motion to accept or to adopt our draft committee recommendations to this point.
Mr. Chair,
Is there a motion?
I make a motion that we move forward on version 3 of the Public Safety Funding Committee draft recommendations discussed on October 10th, 2024.
With that motion, is there a second?
I second it.
With that motion second, all in favor say aye.
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 Any opposed?
Okay.
Okay, thank you. All right. To Danny and Paige, anything else on the agenda item 9 that we needed to cover?
I don't think so. Thank you.
And then as we close the meeting, was there anything else? I know at the start of the meeting, we talked about our next meetings, and emails will be sent out to us, and then our November 7th meeting is on our calendar. So at this point, you're good, okay. Thank you for your participation in various parts of the county and the United States. We will adjourn this meeting and look forward to our public meetings we'll have in the next couple of weeks. Thank you. Meeting adjourned.
Thank you.